Everyone. For those of you who are at their first presentation with us, I wanted to take a few moments to share what cancer wellness means. Cancer wellness is a holistic approach that supports the entire person at any stage of the care trajectory when living with cancer or when one is a caregiver to someone that's living with cancer. So the oncology team treats the disease we complete with the psychosocial care. We look to meet all of the other needs, and those needs could be physical needs, so such as exercise, physical comfort, pain relief, other than medication, symptom management, nutrition. There's informational needs as well, which are resources and the educational sessions such as this one. There's psychological and emotional needs, so just emotional well-being, be it as support groups, individual counseling, music therapy, and soon we'll have art therapy as well. There are social needs, so the family relationship dynamic, social networks, and community involvement. There's spiritual needs, so hope, belonging, meaning, and purpose of life, meditation. Practical needs, which is daily living, household services, financial assistance, and systemic needs, which is how to help navigate the medical system. So research confirms that when we look into all of the needs or the psychosocial care, there's evidence that it does help with the cancer journey and there's beneficial effect on the healing. So that's the reason for our existence here at WIC. We offer programs or services that are free of charge, thanks to our generous donors, volunteers, and our own fundraising efforts. We work with a large team of professionals, and we're about to enter our 13th year of existence. And as we continue to work closely with the cancer care offered in hospitals. So tonight we have a special guest, and no worries, like I said, we most likely will be finished by the start of the hockey game, so we picked the timing perfectly for tonight. Thanks for joining us, everyone. Our guest tonight is Dr. Maxime Paris, who's the president and CEO of EXKA, which is a Quebec-based company with reaches across the world. He's here to talk to us about the science of cannabis. Dr. Paris has extensive knowledge in agricultural biotechnology, plant molecular genetics, and the financial world, which makes for a perfect mix for success. We've divided this session into two parts. So the first part is for us to gain a better understanding of the science of cannabis and the latest development, and then there'll be part two, which is what we want to discuss what this means in the field of oncology. But before we start, I have to share, there are some pretty intimidating words in this presentation, but I'll definitely try to do my best. So welcome, Dr. Maxime Paris.
Thank you very much for the invitation. It's a pleasure to be here.
First question, how long has cannabis plant been around and which climate does it grow in?
Oh, well, the cannabis plant has been around for a very, very long time, and its use has been documented for almost 9,000 years, where we found in the archaeological sites seeds that were probably consumed for their proteins. The use for like the ritual use of cannabis was probably a few thousand years later. It's not really clear, but it's been used for millenniums before the wheel was even invented, for both for nutritional reasons. There's the seeds that can be consumed for their protein contents, and for fiber. So sails and ropes were made with hemp, which is cannabis, and then it's grown in mostly subtropical areas. The epicenter of cannabis genetic diversity is in Nepal, in the north of India, and in China, where different varieties exist and have been used for a long, long time. It supports weather all the way down to 1 degree Celsius because it can actually survive at a very low temperature. And it's an annual plant, so it does its cycle over the summer and it flowers in the fall, and then the plant dies and then the seeds germinate in the spring. So, and it's basically grown all around the world now, but its origin were in Central Asia.
Interesting. Are there many varieties or different species of the plant?
Well, over time, different taxonomists, so specialists of plants, have called the different species. There's Cannabis sativa, Cannabis indica, Cannabis ruderalis, which is more of a wild variety that's stubbier. But for the last 25 years, most taxonomists have agreed that Cannabis sativa is one and only species with subspecies, which are, again, indica and ruderalis. But it has to be said, there are multiple cultivated varieties, which we call cultivars in the industry, but they're not registered varieties. They're varieties which we call also strains. Some have got higher THC. We'll go through that a bit later, but some have got different chemical profiles. And we actually propagate those varieties at our laboratory in Mirabel. There's varieties with high CBD, high THC, vice versa, balanced, and so there are thousands of different strains.
At your plant in Mirabel, how many strains do you have?
We probably have close to 50 different strains, and we have a gene bank too, like which we've got thousands of seeds which have yet to be germinated and characterized. And it has to be said that cannabis is a dioecious crop, which is a big fancy word for two sexes. So there are males and females. And we focus on the females because the females have got the flowers. The males have got some economic value, but for fiber, but not for therapeutic reasons. So we clonally propagate females, and we currently have it's probably 25 varieties that are actively propagated at the moment, and we keep some in our clonal repository for genetic storage and characterization.
So the female has the flower. Is that where the phytocannabinoids are stored?
Exactly. So the flowers are where the cannabinoids are produced, and these are the compounds that are used for therapeutic reasons. Yeah, exactly.
And I believe there's quite a bit of cannabinoids per plant. How many approximately?
There's more than 100 that have been characterized, but the most famous ones are the ones that are in higher concentration are THC, which is tetrahydrocannabinol. Everybody just uses THC, the word, and CBD, which is cannabidiol. The molecules are very, very, very similar. Like there's just like a double link that's missing on one of the two, but they've got very different characteristics. And the CBD is not psychotropic. It doesn't cause the euphoria, but it's used to treat pain and anxiety. And THC also has some therapeutic benefits, also for pain, stress, muscle spasm, and they can be used in combination. The THC does have some psychotropic effect, which causes with the euphoria or the buzz, if you like. It helps in sleep as well, and some appetite stimulation. And then there's a lot of what's called interpatient variability. Patients would react differently just based on their own genetic makeup. So there's a lot of discovery to be done, and you have to start with low doses and see how you react to see what is good for you. But a lot of time for sleep you would use a concentration with more THC, then you would sleep over if there is some psychotropic effect, it would be during your sleep. If you want to have a normal day, you'd use more CBD than THC.
Oh, first of all, thank you for taking those big words off my plate so that I can go straight into the abbreviation THC and CBD. How do these two relate to the two different kinds of plants, indica and sativa?
Seriously, the indica and sativa, they're like subspecies. They're fairly similar. There's a bit of lingo in the industry saying like indica is more like in the couch, would make you sleepier. Sativa is more euphoric. we see it in our lab here. There's a leaf morphology difference. The sativa is very thinner leaves than the indica, which is stubbier. Greener. The indica is a greener plant, which, I mean, it doesn't have much impact on our conversation here, but the indica is more of a sleepier effect than the sativa, which is more of an uplifting effect.
I love in the couch.
Yeah, the indie couch is used in that. I mean, it's been used in the industry, yeah, for sure.
Other terms that we hear about are terpenes and flavonoids. What are those?
The terpenes are all the flavors and the odors which we can find in, for example, lemon rind is limonene. It's a terpene. Pinene is what you would smell in a pine cone or your Christmas tree, is pinene. These are terpenes, which have been used forever in the food industry, and they're not controlled substances by themselves. They don't cause any buzz. They are consumed in they're consumed in your daily diet, and they have been documented to cause what's called the entourage effect. Both CBD and THC benefit from terpenes, where they're part of the product, and they're not really how do you say it's part of cannabis. Definitely. Flavonoids are much less characterized. It's secondary metabolite used for plant protection, and they're not, usually we don't get a flavonoid profile on our products. We do get terpene profiles and cannabinoid profiles.
Oh, okay. So what are the possible methods that we can consume cannabis?
So the traditional method is by smoking, which is not very inhalation, which is not very pharmaceutical. What we do here is we extract the cannabinoids from plants and we transform it into a pharmaceutical delivery method, which is oil. There's oil that is extracted from the cannabis flowers. And so again, the inhalation is really traditional. It's rolled or smoked in a pipe. It doesn't cause cancer as opposed to tobacco smoke, but it's still not a very nice delivery method. It can cause emphysema and shortness of breath, but it's a very fast delivery. Within 60 to 90 seconds, it reaches its peak concentration in blood. The drawback is that it only lasts 60 to 90 minutes. So as a medical compound, you have to take this like 15 times a day, which doesn't really it's not a lot of very practical. But the blood concentration becomes very high, and then it comes down quite rapidly. The other method of choice is through ingestion, which we can have oil in a cup of herbal tea, or just straight oil in a spoon. It's easier to dose as well, because the smoking is not easily dosable. There's what's called the smoker topography. People would just smoke differently, and which makes for a lot of variability into the effect or the concentration that it causes. So we don't really favor smoking as actually we don't favor smoking at all as a delivery method, yet it is still used, and some patients find it very convenient because you can have a little bit of it, and it's, so that's, I mean, traditionally that's how it's been used. Today you've got access to capsules with oil in it. There's also inhalation by vape pen, which is still, it's oil and it's a fast delivery. The ingestion lasts quite a lot longer. It can last 4 to 8 hours depending on your metabolic system, the speed of your metabolism. So that's typically it's good. It's good as an ingestion method. And then there's a few other methods that have been tried with not a lot of medical proof, like transdermal patches, suppository. It's different methods that I would qualify as experimental.
Oh, okay. And once it's entered our body, how does it work inside of our body? What does it bind to?
Okay, so it stimulates the nervous system, and by stimulation I don't mean necessarily uplift. It stimulates the endocannabinoid system, so it triggers different it triggers your system to regulate like cognition, sleep, the energy as well, and inflammation. It has to be said, it's got quite a bit of inflammatory potential. I just saw a question there that I think was related to what I just said. So it is suggested that CBD is best consumed accompanied by a full spectrum mix of THC. What therapeutic benefit are associated with full spectrum and non-full spectrum mixes of CBD? So there again goes back to that's a question from Gordon Adamson. So there again, to repeat it, it's the interpatient variability cannot be more stressed. People react differently. Some people don't react well to THC because of the psychoactive component of THC. And there's a lot of debate on what is good for who. So it has to be tried though. So CBD plus THC does work very well, and they have synergistic effects. The difference here with full spectrum and non-full spectrum, the full spectrum is when the terpenes are there. Non-full spectrum is when the terpenes are removed. And then again, it has to be tried, but it's been documented that the full spectrum has more effect than the non-full spectrum.
We talked about the duration inside the body. So inhalation or vaping would have the shortest effect. And
exactly right. So inhalation is 60 to, in some cases, maybe 2 hours. And it has there's a very quick peak, and then the slope of the reduction is also quite steep. So that's a short duration, so not very convenient for patients. The ingestion, the peak would be lower, but would last a lot longer. And then we're also working on formulations that could be for controlled delivery, which it'll come over the next few years, where we'll have like once a day or twice a day delivery methods, controlled release. But that's still experimental at the moment.
And what about topical? Where does that fit in for the duration?
Okay, so again, I didn't mention topicals. Topicals is a very small category, but it's been used, and with some proofs of CBD creams that are used. The problem with topicals with THC is that the limit in Canada is that you can only have 10 milligrams of THC, which is a very small dose for topicals. So the effect would not be, there's no upper limit around CBD. So we're working on CBD creams, topicals, we'll see, but it doesn't, how do you say, commercially, it hasn't picked up very much. It represents 0.5% to 1% of overall sales. So I think that's a bit of a testament on where it stands. Maybe over time you'll have better formulations. Well, topicals are definitely another delivery method that I forgot to mention. There's a question from Catherine on, are oils okay to consume under hormonotherapy treatments? Does it diminish the effect of hormonotherapy? Does it help prevent cancer? Okay, these are 3 questions there. I don't think there's any adverse reaction between hormonotherapy and THC and CBD that I've seen, but I would I would encourage you to speak to your doctor who prescribes the hormonotherapy. And I don't think that it diminishes the effect of hormonotherapy, but again, I would encourage you to speak to your doctor prescribing the hormonotherapy. And in the case of cancer prevention, there's talks that it does, but it's very difficult to qualify prevention of cancer. So cancer is usually a question of switches over time. But a lot of pro-cannabis would say it helps pretty much cure everything. It's not. It's still a very soft drug with its limitations. But the advantage of it is that the adverse reaction profile is much better than many other drugs. So it's less powerful, yet it has less adverse reactions. I couldn't state here that cannabis prevents cancer. It wouldn't. I don't think that's a reasonable statement. But I have heard it more than once.
So now we're segueing into the oncology side of our presentation, and we'll go through all the questions at the end to make sure that we haven't forgotten anything. So when we talk about medical cannabis and oncology, what's most known is how it helps with the management of side effects. Which side effects are we talking about the most?
So I think the most side effect that we hear about is reducing nausea. There's also reducing some type of seizures, can improve your mood, stimulate appetite, and in some cases also stimulate euphoria, which can be welcome in some cases if your treatment causes some sort of depression. You can reduce anxiety as well. It can help reduce insomnia and stress.
Do you have any stats to share with us with regards?
Yeah, actually, I do have some stats which have been reported from the Colorado Medical Cannabis Registry Program statistics. So these are patients that are in programs of different sorts for not all cancer, but the reported condition for which cannabis has been prescribed the most by far is severe pain. And that's 93% of prescriptions at the time of this study were for severe pain. Then the second indication was for muscle spasms. And that's that's for severe pain was in 93% of patients that was prescribed for. And then in some cases, the number will add up to way more than 100% because in many cases it's prescribed for multiple reasons. The second reason was muscle spasm. So that's 25% of patients used it for muscle spasm. 13% of patients used it for severe nausea. And only 4% of patients actually reported using it for cancer. But then it's, of course, with cancer, it comes in many cases severe pain and severe nausea, and in some cases some muscle spasm. What also could be said in terms of statistic is that last year, the last year that cannabis was only legal for medical reasons in Canada, which is 2017, cannabis was prescribed for 165 different indications. So it's been prescribed for a ton of different reasons. And some patients find that it helps them deal with some situations. So it's very broad spectrum. And again, CBD, THC with full spectrum, non-full spectrum, used differently. And there's a lot of repeat there. So patients find some advantages to using cannabis for medical reasons for sure.
And what other medical fields would it be used other than oncology?
Oh, well, the first one is pain. Then in psychology for anxiety. So a glaucoma, okay, so that's another indication. So that's ophthalmology. It's been used to stimulate appetite in HIV and AIDS. So quite a few fields. We have met quite a few generalist doctors that have specialized in cannabis prescription, and they meet a lot of dermatologists have used cannabis for when we talked about topicals a little bit earlier. Yeah.
Nature is amazing. And so we're talking about the usage. What is a safe usage? I always hear the key phrase is start low, go slow.
That's pretty broad. So, but it's true. So for sure, start slow, start low, go slow, because people react differently. So typically, a dose of cannabinoid was counted as 10 milligrams, whether we're talking about THC or CBD. And some now have tried to reduce this to 5 milligrams, but that's for THC. But you see, different doctors have prescribed CBD on a daily basis between 50 milligram to 1,500 milligram. So that's a big range, which means that people react differently. But again, CBD does not have psychotropic effects, so you won't be feeling an overdose of having too much. And as opposed to THC, if you have too much, you can have some pretty serious psychological effects. So advice would be to start at 5 milligram and see where that takes you. And then if you don't feel the therapeutic benefits, to try to, and don't feel any side effects, go to 10 milligram. And here I'm talking about ingestion, oral delivery, which is very difficult to quantify with smokable cannabis, but I'll still have a try here. Some varieties go all the way up to 25 to 30% content, which means that in 1 gram you would have 250 to 300 milligram of THC. But that's for, if you smoke this, 80% of it will be lost in smoke. And then the part that you would inhale would also have not necessarily a huge delivery. So, and the same goes with ingestion as well, because the way your metabolism works is it's different for everyone. So what's the safe usage? Is start low, go slow, see if you have to notice some benefits before you would use this therapy. But again, a lot of people do see benefits and have used it on a repeat basis. I've seen that it stimulates their appetite, helps them sleep, helps them reduce anxiety. So, but again, THC 5 to 10 milligram is a reasonable dose. And again, some would use a lot more. And you'd have to see where how you react. And again, interpatient variability is huge. People just have different speeds or ways that they react.
Is there anybody who should not be using cannabis?
Well, anybody under the age of 21, that's what doctors usually say. Where, again, it's like it may cause some, in some cases, some dependence has been reported, but that's with abusive use over 1 year, people 2 years, 3 years, young people taking 1, 2, 3 grams of smoking cannabis on a daily basis would become psychologically addictive. There's no overdose to cannabis. They've tried stuffing rats with cannabis, and actually the rats that were stuffed with cannabis survived longer than the control group with no cannabis. And what's called the LD50, which means the dose that would kill half of the population, was the equivalent of about 25,000 joints in 1 hour. So, I mean, you won't, cannabis is not going to kill you unless you do silly things once you've consumed a lot of it. But there's that question, is THC addictive? Not documented on a physiological basis, but if you use a lot of it, too much of it for long periods of time, you would, feel the need to keep having it. It's more as a psychological addiction. And I saw that, I think there's a few questions that I missed. Okay. So my understanding is that there are individual differences in how patients experience the effect for anxiety. Is this dose related? I would think that yes. Again, interpatient variability, people react differently. But if you take too much of it, I think it could probably increase anxiety. But that's, again, what you said earlier, start low, go slow, and see how you react. And if it helps reduce your anxiety, then you found something. If it doesn't help you, maybe you can try having a little bit more. But if you see an increase in anxiety, it's not the right treatment. That's for THC. Same goes for CBD. Any examples of synergistic effect with chemotherapy? Oh, this okay. And immunotherapy drugs in treatment of cancers. This, I think you would have to ask your doctor, because synergistic is a big word, difficult to document, and I can't really answer that question. So is THC addictive? We answered this question. Please comment on the sleep aspect of Woodward ingestion of 2.5 milligram THC gel for intermittent sleep sufferer. I think that's a very low dose, but that's a good start, 2.5 milligram. If you see that your intermittent sleep suffering continues, try 5 milligram. I've seen people use 20 milligram to go to sleep and have a great night of sleep. I've met some bankers of 55 years old who said that, look, I've never thought of using this, but since it's legal,
Whoops.
Oh,
okay,
I've been muted for a long time.
No, just a fraction of a second. Now we hear you again.
Okay. So I've met people who said that around 55 years old, they were always waking up at 2 in the morning suddenly, and now they use 20 milligrams of THC just before going to bed, and they sleep like a baby until 6 or 7 in the morning and feel much better, much more rested. So to go to bed, again, start with 2.5, 5 or 10, see if that improves your sleep, and then, but above 20 is a lot for THC. CBD, again, I said it earlier, but it could be 50, 100, 1,000 per day, and then you might see some benefits.
So how do you access medical cannabis in Quebec?
Okay, so that's what's changed over the last few years. All of the provincial distribution, unfortunately, is not in pharmacies. So it's through the SQDC, which there's 70 outlets now. Most of them, I think, are in the area of Montreal. And you can have this online as well. There used to be some compassion centers, which I wouldn't recommend going there because they basically take their supplies from the black market, which is not controlled, as opposed to everything that comes from the legal market, such as the big companies that we find their products on the shelf, go through rigorous quality assurance, quality control processes, similar to the pharmaceutical industry. We've just gone through an audit with Health Canada. There's extremely rigorous. Everything here, there's cameras everywhere. They look at everything, all our processes. It's all gloved. Any compounds that we could use on our plants has to be approved. Every batch needs a certificate of analysis to prove that there are no pesticides, no microorganism, and all those things, which is very welcome as for pharmaceutical industry. But to answer your question, today in Quebec, you have to go through the SQDC. So get your advice from your doctor from what you should have. There are oils that are available. There are capsules that are available. There are now drinks, of course, flowers for smoking if you feel inclined to try that. It has been recommended by doctors. So that's where I would go, and it's legal. It's sent with Post Canada to your home, and the price is actually quite okay. It's like as the black market was more expensive.
So I think you touched on a very good point, to have the discussion with the primary physician or the oncologist, so that they're aware that you were going to try this medical cannabis. But what if my primary physician or oncologist is not open to it? What are the suggestions would you have?
Well, that's the question I'm not really sure I can answer, but there are some studies that showed that in early 2000, about 5%, 5 to 10% of doctors were in favor of using cannabis for medical reasons, and that has gone up to 50 to 60% more recently. So if you're an oncologist, I would encourage discussion, getting an education, not necessarily changing your oncologist, but you can see a generalist with your problems to discuss your situation and open up to having the discussion. But the thing I didn't mention that's very important is that a prescription is no longer required for. So this is, closer to self-medication. Then if your oncologist completely disagrees, then maybe there are some reasons for it. Maybe there are some adverse reactions that according to your treatment, because treatments in cancer are, very, very broad. There's tons of treatments. Again, for the question on hormonotherapy earlier, that's why I would encourage you to speak to your doctor before taking my advice here, I'm only a plant specialist. I'm not a medical doctor. I'm a plant doctor. So that's, I understand the plant, how it's grown, how we extract cannabinoids from the plant. And I'm fairly well educated on what's out there in terms of scientific literature, but I'm not going to take the place of your medical doctor for your cancer treatment. So if your oncologist disagrees, I would encourage discussion. And if it's only for philosophical reasons that he disagrees and not medical reasons, then you could try to test again, as you said earlier, start low, go slow, see where it takes you. There's millions of people taking cannabis and seeing benefits. So you could go that way. There's a few questions that appeared in the last minute. Peer-reviewed studies showing that CBD lowers blood pressure. I'm not sure. That's not a primary indication for cannabis for blood pressure. So I don't know the answer. The takeaway is that CBD has no psychotropic effects. That's right. Correct. That's correct. Would you recommend CBD for elderlies experiencing extreme physical pain and suffering from dementia? I would. I'm not familiar with Lewy body though, so I can't talk to this, but I would recommend speaking to your doctor. But for extreme physical pain, both CBD and THC have some synergistic effect. The first time user, a 2.5 milligram THC plus 1.75 milligram CBD gel. Yeah, that's good. Was recommended for sleep. At 2.5 milligram THC, I don't think you'll feel a big euphoric effects during your sleep. You could try just CBD because CBD is available, just pure CBD. There's always a little bit of THC. Because the pathways by which CBD is manufactured in the plant, as I said, the molecules are very similar. There's a little bit of CBD, or there's a little bit of CBD in the THC plants, and vice versa. There's a little bit of THC in the CBD plants. But once we extract CBD, there's very little THC left at the end. But nothing to be concerned, I don't think, about when you talk about euphoric effect. It's not like if it was like an overwhelming euphoria. Oils are usually given with the syringe, so in ml. So that's just to count what it is. So there's different things. There's an oral spray, which we also call an atomizer, which you can spray 0.1 milliliter at a time, and that's available on the market. Or with a syringe, or just drops, and a drop is 1/20th of a milliliter. So every drop is 2 drops is 0.1 milliliter. 20 drops is 1 milliliter. So a good dose in ml is, so it could be a trick question because that would be highly dependent on the concentration of the product, and the products vary a lot in concentration. So usually it's written on the label that what is a dose in ml. So if you have a product that is 20 milligram per ml, you would only take half a ml. Okay, the cost for good quality CBD. That's it really depends by manufacturers. There's still a lot of different price points, but typically a bottle would be around $50 and could probably last. Uh, Again, it really depends on your dosage, but it would last several days, and that's the CBD product. Sorry, that's to answer your question. Yes.
Let's talk a little bit about the legal side of it. So how much medical cannabis can a person have on them at one time?
Excuse me, can you repeat the question?
How much medical cannabis can a person have on them at one time?
Oh, legally, I think you're allowed to have 30 grams of dried flowers. And there's, which again, I wouldn't recommend dried flowers, but the oils, like the oils that we are manufacturing in little bottles like this, you can have close to 80 bottles of it, and legally, because there's an oil equivalent. That is the conversion is, and it's a bit strange how Health Canada measures this, but this is it says that 70 milliliter is equivalent to 1 gram, whatever the concentration of the product is, which is not a very good calculation, but that's how it's done. So you can basically have 2 liters of oil and legally be okay.
Can we cross borders, either provincial or country borders, with our
Okay, so that's an important question. So you can't cross country borders, even with a prescription, especially not in the US, even though in the US there's about 30 some states allowing cannabis for medical reasons. It's still federally illegal. And then the provincial borders, I think, yes, but I would encourage you to check because I don't know the answer to that question. Because apparently, legally, you're not allowed to cross borders with a bottle of wine and provincially, but I don't know anyone who ever got caught. Only if they went to encourage the Maple Leafs in Toronto. Sorry.
Are there any guidelines with regards to consuming the cannabis and driving?
Yeah, well, for CBD, no, because CBD again is not psychotropic, but for THC, definitely avoid driving.
And are we obliged to tell our employers we're taking it?
I don't think so. Maybe my colleague Sebastian can talk about this. Look, I don't know the answer to that question. If it doesn't impair your work, I don't think you're legally obliged, but I don't know the answer.
And what can we expect in the coming years in this field and its potential use?
Well, for sure, there's a lot more acceptance than before, and a lot more patients are actually opening to it and seeing the benefits. To go back to the first question that you asked me, cannabis has been used for thousands of years. It's not like a new drug that's patented or it's not a miracle drug. It's a soft drug that has overall benefits not for everybody. So it's not like a blanket therapy that will help you never die. It's not, some people have told me like it cures cancer, so that's not true. But if what's going to happen over the next few years, I think will be a much better understanding on who reacts in which way. And there's a field called pharmacogenomics, which means that you can sample your DNA with a minimally invasive test, just with a little blood test, and see how you metabolize different things and tailor your drug treatment in consequence to that genetic profile. And so I think this is one thing that's going to happen, where in your condition, your situation, you'll have a test and see, look, for you, you should try this dosage. And the other thing that I think that is going to develop are controlled release formulations, which means that you can have the drug, the treatment once a day in a capsule that you will metabolize over the whole day and keep your blood concentration fairly, drug concentration fairly regular over the day. So these are where I think it's going. And we're actually working on the formulation side of it.
Mhm. Before we go to the rest of the questions we haven't answered, did you want to share with us a bit about Exca, the company? Because it's really nice to see a home company flourish.
For sure, yeah, no, with pleasure. I'll see that there's two questions here. Should it be taken daily or only when we feel the need for it in order to sleep? So with mainly CBD. Yeah, I think, well, daily. If you have trouble sleeping every day, yeah, for sure. And if you feel that it helps you, yes. Like it's very difficult. Like I've woken up several times in the middle of the night, but it's difficult to plan for me because it doesn't happen all the time. So when it happens, then you can also have with ingestion, which what I didn't say earlier is it takes about an hour to have an effect. So if you wake up at 2 in the morning, then it might be a bit too late to have this. So if you wake up every day at 2 in the morning, then why not? Daily use, again, there's no dependence, very, very little adverse effects. So, and it's well metabolized in the body. Might regular use of cannabinoids place you at risk if police decide to take a blood test? Well, I mean, if police decides to take a blood test, they must have a pretty good reason for it. And if you have a good medical reason for it, because that's another debate, right? As opposed to, for example, breathalyzer alcohol tests are very well documented. If you have a breathalyzer, they know that you're at this level and that's it. As opposed to if you smoke cannabis, it can last for a lot longer, and it's difficult for the police to say, like, maybe you had cannabis yesterday, you were driving today, you've tested positive. And so this technology for detection is not really well organized. And again, does it cause you like, I would talk to my lawyer instead of to me for that question. Does CBD help with the pain of debilitating arthritis? Apparently it does, it's documented. So I would encourage you to try it. Now, to talk about our company, Exca, we're passionate about cannabis genetics. So we propagate plants in vitro, which means in test tubes. We have a plant tissue culture laboratory. I'm a plant specialist. I did my studies in botanical sciences at the agricultural faculty of McGill University at McDonald campus in the West Island. And I started working in the genetics laboratory when I was 19, before I had white hair anyway. And then I started working on genetic improvement of field crops, oats, barley, and wheat. And I worked in a program for improving field crops in Australia, where I earned a PhD in plant molecular genetics. And so a few years ago when we started Exca, I saw that there was a need for well-documented genetics, varieties, just varieties of cannabis, poorly documented. It's been, again, used for thousands of years, but illegal for the last 100 years. So very poorly studied. A lot of attic science or basement science, I would call, where it's been grown in basements and attics illegally by, gentlemen farmers, you could say, but not organized with like studies with multi-center universities. So this is one thing that we do. We propagate varieties at Exca. And then after that, we sell clones. So there's little plantlets that go to our clients, which bring them to flowering. They flower those plants, and then some of them come back to our laboratory for extraction. So we have a pharmaceutical laboratory for transforming cannabis flowers into cannabis oil of pharmaceutical quality.
And out of curiosity, how did the name come about, Exca?
So Exca was for extraction and cannabis. And it also stands for our corporate values, which are excellence, knowledge, and adaptability. It's a fast field. We strive for excellence, develop knowledge, we share the knowledge, and we also need to be adaptable.
For everyone, Dr. Paris has mentioned it several times, and I just want to re-emphasize that it's important to have the conversation with your oncology team or your general physician so that we can keep everybody safe and you can keep yourself safe. I'm just going to look at a quick scan of the questions. Make sure that we covered everything. Looks like we did. Perfect. Well, I can't.
Feel free to contact us if you have any specific questions, but as I mean, I encourage you to speak to your oncology specialist. Of course, we're plant specialists, we're extraction specialists, and it's like we're passionate about making it more accessible to patients and reducing its cost. It's still a fairly expensive therapy that's not reimbursed in most cases. So it has to be, over time, I think the prices will come down.
Thank you very much for your expertise and sharing your time with us. We're very grateful and very appreciative.
That's my pleasure. Thank you very much.
Thanks, everyone.